Miss Kayla. My name is Lacey. I'm a nurse practitioner student at South University. I'm going to put some gel on my hands and go ahead and wash those. I'm going to go over your vital signs that the nurse got for us at the front office. Your heart rate was 72, respirations are 16, blood pressure is 128/80, O2 is 98% on room air, and your temperature is 98.2, all within normal limits and look really good. Do you have any mental health concerns that you want to talk to me about today?
No.
Okay, I'm going to go ahead and get started on your head to toe assessment. I'm going to start by palpating your head and scalp, looking for any lumps, bumps, bruises. I do not see no signs of infestation, and I'm going to go down to your temporal artery to feel for your pulses. Any pain there? All right, I'm going to move down to your jaw here. Will you tighten for me? And then release. Any sign of pain? All right, so no signs of TMJ and indicating that cranial nerve 5 is intact. All right, if you will raise your eyebrows for me. All right, puff out your cheeks and let me see your teeth. Good, that indicates that cranial nerve 7 is intact. I'm gonna do a sharp, dull sensory test. You let me know if you feel something sharp or something dull. Close your eyes for me.
Soft. Soft. Sharp. Sharp.
Very good. So that is also with cranial nerve 7 intact. And I have a Sneeden chart behind me. If you could close your left eye and read the smallest letters that you can read.
ORSTM.
And close your right.
ORSTM.
And read both.
ORSTM.
Do you wear corrective lenses or contacts?
Yes.
Do you have them in now?
I do.
Okay, good. So your vision is 20/20 with corrective lenses. All right, I am going to get you to close your left eye and don't move your head and just try to tell me how many numbers I'm holding up.
2. 1. 1.
And close your other eye.
2. 1. 1.
Okay.
2. 2. 1.
Good. So your vision and confrontation was mostly intact. All right, I'm going to come and look at the structure of your eye. Your sclera is white, your conjunctiva is pink, your iris is green. Very good. All right, I am going to also check your pupils. And just keep your head straight. All right, you do have pearl, which is showing that your pupils are equal, round, and reactive to light. I'm going to check your accommodation. If you'll just follow my pen and don't move your head. Very good. I'm going to check your cardinal field of gaze as well. If you will just follow my pen, do not move your head. Good. I'm going to take my scope and look into your eye. Good. So that shows that your red reflexes are present in both eyes, as well as your vessels and structures both look really good. All right, I'm going to move along to your ears, and just by physical appearance, has no redness, lesions, or rashes. Do you have any pain?
No.
Okay, let's take a look inside your ear here. All right, it's nice and pearly gray. A little bit of serum present in this ear, otherwise. All right, and this part of the exam, I would use my tuning fork to do the Renee test and the Weber test. Although I don't have one now, I'll explain to you what it is. I would take my tuning fork, make it vibrate, place it here and here, here and here, and you would tell me which side you could hear it better in. I would also take it and vibrate it here, place it on the top of your head, and you would tell me if you could hear it better in both sides of the ear or the same in both. All right, so I'm going to move on to your nose. If you would lean your head back for me. All right, I'm going to take a look. It's nice and pink, no lesions present. If you would occlude one nostril with your finger, breathe. Very good. If you would close your eyes for me. And I am going to check your sensory test. And if you would tell me what you smell.
Alcohol.
Very good. All right, and I'm going to move on to palpate your frontal and maxillary sinuses. You tell me if you feel any pressure or pain. Okay, and I forgot to mention when we did the smelling test, that was your cranial nerve number 1, and it is intact. All right, so let's move on to your mouth. I'm going to throw some gloves on here. And just by the appearance, your mouth looks, your lips look nice and pink, no excessive dryness. And I'm going to get you to open your mouth. Very good. All right, your mucosal is nice and pink. And open and say, ah. I'm going to get my tongue blade here and take a look at your tonsils. All right, one more time. Tonsils are a 2. Uvula is midline. No dental caries, so that looks all really good. And if you could stick out your tongue for me one more time. All right, showing the cranial nerve 12 is intact. Okay, could you swallow for me? Okay, you can swallow and you speak well, so cranial nerve 9 and 10 are both intact. Stick out your tongue one more time. Okay, that's showing the cranial nerve 12 is intact. All right, and we're going to move on to the neck portion of our assessment, and I'm going to start with palpating your lymph nodes. I'm going to start with the preauricular, the postauricular, the tonsillar, submandibular, submental, anterior cervical, posterior cervical, and the occipital. All right, if you would raise your shoulders, I'm going to palpate the supraclavicular. And while we're here, try not to let me push down on your shoulders. Okay, and that shows that cranial nerve 11 is intact. I'm going to do range of motion for your neck. If you would do chin to chest, and turn left, turn right, left ear to shoulder, right ear to shoulder. Any pain with that? Okay, I'm going to go behind and check your thyroid. Okay, just going to palpate your thyroid here. Could you swallow for me? Do you have any pain with that? Okay, and while I'm back here, I'm going to do the whisper test. If you would cover your left ear and try to repeat if you can hear the sounds. 1, 2, 3.
1, 2, 3.
And the other side. A, B, C.
A, B, C.
Very good. All right, so we're going to move on to your shoulders. I'm going to inspect those. Skin is dry, intact, and normal color for ethnicity. All right, I'm going to palpate the sternoclavicular, lymph nodes, acromioclavicular, and subacromial. Is there any tenderness there? Very good, okay. Let's go on to range of motion. If you could rotate your shoulders back and forward. All right, let's go into your elbows. If you could move your left hand and go out. Right hand, go out, and then with both. Great. All right, I'm going to move on and feel for your radial pulses. Your brachial pulses. And they are 2+ bilaterally. Let's check your strength. If you would squeeze my fingers. All right, and lift your hands up and try not to let me push down. Very good, and I'm going to do it the other way. Very good. So that's 5 out of 5 strength. Okay, and now we're going to begin the posterior chest assessment. So I'm going to walk around to the back. All right, and every time you feel my hands do like this, if you will say 99, please. All right?
99, 99, 99.
Okay. And when you feel my stethoscope against your back, if you would please say E.
E. E. E. E. E. E.
Okay, and again, if you could say 99.
99. 99. 99. 99. 99. 99.
Okay, I'm gonna listen for your breath sound, so you just breathe normal, please. Okay, breath sounds sound good. There's equal bilaterally, no sound of bronchi or wheezing, and negative for ecopy and bronchoscopy, and tactile frenemus is symmetrical bilaterally as well. All right, I'm gonna do some percussion. You let me know if you feel any pain, okay?
Mm-hmm.
Okay, percussion is resonant, and I'm gonna check for CVA tenderness. Let me know if you feel any pain. Any pain? Okay, very good. And I'm gonna get you to go ahead and lay back on the bed for me. And we're gonna move to your anterior chest and neck assessment. All right, and I'm noting that the diameter is smaller on the AP side, which is normal. And I'm going to palpate your carotid, and I'm going to listen to it one at a time, okay? Okay, that is 2 plus bilateral and no bruit heard. Next, I'm going to listen to your heart sounds. Start with the aortic. Pulmonic. Tricuspid. And mitral. And I'm also listening for PMI as well. So there are S1 and S2 sounds heard, no S3 or S4 sounds, which is good. I'm also going to listen for your lung sounds, okay? I'm going to start at the apices. Listening for bronchial sounds. Bronchiovestibular sounds. And the lung bases. And those all sound really good, and vestibular sounds were heard throughout. Okay, now we're going to move on to the abdominal assessment of the head to toe assessment. If you'll just lean back for me, and I will lift this bed up and visualization. And just visually looking at your abdomen, the contour looks normal. There are no scars, no striae, no hernias, no visible pulsations going on, and your umbilicus is midline and inverted. Okay, so I'm going to start with listening to your bowel sounds first. Okay, you have active vowel sounds in all 4 quadrants. I'm gonna move on to the vesicular sounds, starting with the abdominal aorta, renal arteries, iliac arteries, femoral arteries, and no sounds of Brutes heard. Okay, I'm gonna move on and percuss your abdomen. Let me know if you have any signs of pain, okay? Any pain? Okay, now I'm gonna palpate for any kind of rebound tenderness. Any tenderness? Any pain? Very good. Alright, I'm gonna move down and look at your legs and your feet, noting your skin color is warm and dry. No signs of edema here. Alright, I'm going to check your pulses. I'm going to start with the femoral pulses. Good. Those are 2+ and equal bilateral. Popliteal. Inside as well. 2+. Dorsalis pedis. 2+ bilateral. And the posterior tibial. 2+ bilateral as well. Alright, we're going to check your range of motion and dorsiflexion and plantar flexion. If you'll point your toes and then flex them. Very good. If you'll come against my hands, try to pull against my hands. Good. Try to push against my hands. Very good. Alright, I'm going to get you to bend your leg. And straighten it out and pull your, okay, and try to push, don't let me push you down. Very good. Other side. Okay, straight up. Same thing. Try not to let me push it down. Alright, good. That is 5 out of 5 strength. Now we're going to test your sensations like we did on your face. You let me know if you are feeling something soft or something sharp. If you'll close your eyes for me. Soft. Sharp. Sharp. Soft. Good. So your exterior sensations are intact. And that wraps up the abdominal section. Alright, Miss Kayla, we're going to start the final portion of our physical assessment with the neurological testing. I'm going to start off with the stereogenous object ID. So if you would close your eyes, I'm going to place an object in your hand and you tell me what it is.
Okay.
Good.
Pen.
Alright, I unfortunately don't have the tool to correctly do the deep tendon reflexes, but I'm going to use what I have and check your deep tendon reflexes, starting with your brachioradial, your bicep, tricep, you do it on both sides, brachioradial, bicep, tricep. Alright, I'm gonna move down to the patellar. Alright. To the Achilles. Alright, and while I'm down here, I'm gonna check your plantar response. I'm just gonna rub this on the bottom of your foot. And there is a negative Babinski there. Alright, next we are going to test your coordination. Alright, if you'll stand up for me. Alright, what I'm going to get you to do is it's called a point-to-point So you're gonna touch your nose and then touch my finger as fast as you can. Okay, other side. All right, we're gonna do that with your feet as well. Touch the floor and then touch the bottom of my foot. Okay, other side. Very good. Up next, we're gonna assess your strength and balance with the pronator test. So if you could just hold your hands out straight for me, and I'm gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and keep your eyes closed, and we're gonna do the Romberg test. Very good, and those are both negative and both really good signs. I'm gonna stand behind you and just be here for balance, but we're gonna do your spine range of motion. If you could lean forward for me. All right, lean back as far as you can. Okay, using your hips, twist to the left. All right, just your hips, twist to the right. Very good. All right, we're gonna do gait and balance. If you can, do about 3 steps for me, heel to toe steps. Very good, and that concludes our head to toe assessment. Thank you, Kayla.